Hey, Jason here with Ketamine Academy again. I want to answer the question that we get a lot from CRNAs, and oftentimes CRNAs are a little confused about whether or not they need physician supervision or collaboration or none of the above, and it's an independent practice state for them. And so the answer to where to find that is I'm going to put up a map here in this video, so you can take a look at that. That will give you a really quick reference, and then I'm also going to direct you to your state Nurse Practice Act. Under your license type in every state, you can typically find what criteria needs to be met in order to practice in your state. So that'll tell you if you're an independent practice state, whether you need to collaborate with a physician or whether you need to supervise or be supervised by a physician. Typically in the states that require supervision, you will see that there's no requirement on the type of physician that can supervise you. So you don't have to be supervised by an anesthesiologist in nearly every state. There's a couple of oddball states where that is the case. In order to administer anesthesia level dosing or actual anesthesia, general anesthesia, there are, I believe, one or two states where you have to be actually supervised by an anesthesiologist, but all of the remainder of the states you do not. You have to be supervised by an MD, a DO, and in most cases a doctor of podiatry is also allowed to supervise a CRNA. And so the place to check for sure in your state is your state's Nurse Practice Act. That'll tell you if you need to be supervised, who is allowed to supervise you, right there in the words underneath what that part of the Nurse Practice Act says that you're allowed to do.